infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, hey everybody, this is Robert, and welcome to Outbreak News Interviews. Now, the future prevalence and virulence of SARS-CoV-2 is uncertain, but researchers at the University of Utah are trying to answer the question. Will SARS-CoV-2 become just another seasonal coronavirus? A seasonal nuisance? And a new study published in the journal Viruses. Well, joining me today to discuss the research and their findings is Fred Adler, PhD. Dr. Adler is the professor of mathematics and biological sciences at the University of Utah. Dr. Adler, welcome to the show, sir.
Thanks. Delighted to be here.
Okay, well, let's start out with this question. Is there any historical context that would suggest that SARS-CoV-2 could be just another seasonal coronavirus?
Yeah, there is. The evidence is very circumstantial. There are 4 seasonal coronaviruses out there, and it's very difficult to trace viral histories. They don't leave fossils. But there's circumstantial evidence that one of the seasonal coronaviruses might have arisen in the 1880s and have been much more deadly at that point. It's fairly clear that it jumped into humans at that time from cows, but it's not clear whether or not the global pandemic of the late 1880s was in fact caused by it. It may have been caused by influenza or some other unknown virus. But nonetheless, there's the possibility that at least one of the seasonal coronaviruses did jump into people at that point and caused a deadly pandemic and is now just another cold.
Right. Now, the study is very interesting, and it tries to answer a question that, many of us are wondering. In the study, you use mathematical models to characterize the conditions under which the immune system can promote avirulence on a short time scale, rendering the virus into just another seasonal coronavirus. You include several factors that may push SARS-CoV towards becoming just another seasonal coronavirus. Dr. Adler, can you discuss these factors?
Yeah, I'll sort of mention them in the order that I thought of them in. So the first one, which may in fact turn out to be the least important, is this idea that people who have mild infections might therefore produce fewer viruses and create mild infections in the people they infect. That is, if you get a smaller dose of viruses, they may be less likely to get into your lungs and cause a severe infection. So that's component 1. Mild infections may make mild infections. Component 2 is something that is well known, that is, children do have mild infections. They do not get nearly as sick as adults. And component 3 is the one you alluded to, the role of the immune system. And so if, as we are with all the common colds, partially immune from having been exposed to them our whole lives, then if we get infected, yeah, we do get sick, but much less so because we're partially protected by our immune systems. So that's sort of the general story. And what's so different about a novel virus like this one is it jumped into a world of adults, older adults like myself, who've never seen this thing before and therefore don't have a lifelong history of training with it. Whereas viruses we're familiar with, you start getting them when you're young, you're less vulnerable to infection, and now you have this nice cycle where you start mild, you may produce fewer virions and thus infect people with milder infections, and you have a lifelong umbrella of partial immunity to it.
Yeah, I think that takes me to this quote I got from you in the university's press release, and it pretty much sums that up. It says, in the beginning of the pandemic, no one had seen this virus before. Our immune system was not prepared, right? We all had a naive immune system. The models show that as more adults become partially immune, whether through prior infection, vaccination, severe infections all but disappear over the next decade. Eventually, the only people who will be exposed to the virus for the first time will be children. And of course, as you said, they're naturally less prone to severe disease.
Exactly. Yeah, that's the logic of it.
Yeah. So you and your colleagues look at these factors, both alone and collectively. I've looked at the study. I've read it. It's kind of complex since I'm not a mathematician. So trying to keep it as simple as possible. Can you talk about the study and the models that were developed?
Sure. I mean, one of the great things about being able to do mathematical models is you can do experiments that are, of course, impossible to do in real life. And the experiment we could do in this case was to look at those three factors I mentioned: milds make milds, children are mild, and partial immunity partially protects, and mix and match them, right? Put them in one at a time. And so we found, and this actually was slightly surprising to me, is that we need to include all three of those factors in order to have the result you just alluded to, right? That this thing really is just a bunch of common colds. Any of the other combinations, even two of those things together with one of them missing, leads to a much smaller proportion of severe infections, but there still will be some number of severe infections. So if I had to guess what the future is going to look like, I think it's going to be somewhere between the two limits. You know, what we've seen now, which is a very severe infection in many people, though a mild infection in some, and this other limit, a mild infection in everyone. I think the frequency of severe infections will go down, but I don't think it's going to go down nearly to zero. But that is just a guess.
Okay. And is there anything else that comes to your conclusion, other than the fact that we're going to have mild infections primarily?
Yeah, I mean, I guess the other conclusion, which you also alluded to, is just the time frame over which this is going to happen. And, you know, that is rather difficult to predict because that interacts with, you know, perhaps the most unpredictable thing in the universe, human behavior. Mm-hmm. And we don't know what this fall is gonna look like in terms of how people are going to behave. And also we don't know, how many people are going to be vaccinated. And, you know, finally, we don't know, in fact, what the long-term effects of the vaccine will be in terms of partial immunity.
Right. Going by some other mathematical models that we've seen during this pandemic, where people really question these results. Dr. Adler, how confident can we be, if confident at all, that the results of this mathematical modeling are any other?
I think it depends on what sort of question you're asking, right? Nobody can predict specifically what's going to happen a month or two from now. Mm-hmm. And I sort of tend to make the analogy with the weather, right? It's fairly well known that we, that is, you know, the scientific community, can predict weather very accurately out to about 10 days. But after that, up to 3 weeks, you really can't predict it. But we can predict climate and season quite well. And so I think, you know, models have done a very good job in predicting, you know, what was going to happen overall, and done a poor job in trying to predict certain details that are effectively unpredictable, and in particular those things that are related to human behavior, and also something we haven't mentioned, those things related to the evolution of the virus itself. Mm-hmm. Yeah. So in terms of these models, I should say, you know, yeah, I don't think what we see playing out in the real world is going to look exactly like any of our simulations. And our goal here was not to predict the future, but to present a possible future and to alert us the evidence of as the future rolls out, which is happening every second, which way are we going, and to be able to use that to help us guide public policy.
It's good to point that out because there were a lot of questions, like with the COVID deaths predictions, the modeling very early on, and which of course didn't come out to be so. Dr. Adler, finally, what's next with your modeling on the coronavirus 2?
Yeah, it's two things. So one is what I just sort of mentioned, which is linking these models, which at the moment are based, you know, only on past data, with data as they come out. You know, in particular, to me, of most interest are looking at two of the components of this model, the two most uncertain ones. You know, one is how can we determine whether mild infections really make mild infections? And that'll require fairly detailed epidemiological studies that are, you know, being done in a few places. You know, we're trying to find people who have that kind of data. Mm-hmm. The second, and this is, you know, in some ways the biggest issue of uncertainty right now, is what will immunity look like, both from people who've had the infection itself and for those who got the vaccine. And will it be sort of 2 years of total immunity followed by no immunity, or will it be 1 year of total immunity followed by a slow decline into partial immunity? That is really the key for what's going to happen. And, since people, healthcare workers and so forth were getting vaccinated in December, we're starting to enter the period of time when we will have the ability to see how many infections those people get and whether or not they're more mild. We know they are. We just don't know how that time course is going to play out. So that's step one, is to link these models with data and, use that to say, hey, it looks like things are going in a really good direction, and we do think that it's going to become just another seasonal coronavirus, or it's not behaving in that way, and then we can revise our predictions.
Gotcha.
The second thing, and this is not directly related to this, but this is my own personal interest, is looking at SARS-CoV-2 as entering the community of viruses that infect us. There's the seasonal coronaviruses, there's the things I've worked on the most, rhinoviruses, of which there are hundreds of different serotypes that give us most of the colds we get, and then a bunch of other things that people may have heard of. These guys are all infecting the same tissue. They're dealing with the same immune system. They're interacting with each other. And how those interactions play out over the long run is very unpredictable, and I think models will play a really important role in establishing what's going to happen. For example, nobody got colds last year. This year is going to be really weird. People may be much more vulnerable to good old-fashioned colds because we had a year without getting exposed to them.
Interesting. Everybody, the study is titled, Will SARS Coronavirus 2 Become Just Another Seasonal Coronavirus? It's published in the journal Viruses, and I'll link to the study in the show notes. And I want to thank you, Dr. Fred Adler, for sharing this very interesting research with us today.
Thanks.